Hi everyone, very good afternoon guys. I hope I'm audible and visible to all of you. I would need a quick confirmation in the chat box. I believe we have students, some of you joining in on the app and some of you joining over YouTube. So be rest assured that I will be taking up queries from both the chat boxes which I have open in front of me. So I hope all of you have joined in. Today's class is shorter than yesterday because I think most of the second prof strategy I have taught you yesterday. I told you what to do and I have given you a brief about pathology. So today I don't have to go again into what to do in second prof, that much of orientation you have. Today I'm going to focus more on microbiology. What are you supposed to do in your second prof, so that this is a subject which is quite, if I can say so, it's a little dangerous as per the students as they call it. And how can you make your foundation and your concept strong in second prof, and that can help you all the way up till your entrance exams, be it NEET, FMG or INI-CET. So yes, I can see a lot of you joining in. That's great. So abhi ke liye, if I just start off, why am I telling you about an entire because prof strategy is because you've just entered into second prof. If you, I'm not saying that you just need to dive into the ocean and you just have to study 24/7. I'm just wanting that we should be able to give you a platform, or we should be able to give you a certain timetable where you can comfortably finish your syllabus, get your concepts in place, and at the same time you can also focus on what is happening in your college, because this is pretty much your time to live that as well. So this batch that we are talking about is about a live batch which is going to start, and it's going to be for second prof. So that means it's pathology, microbiology by myself, and pharmacology with Dr. Ankit sir, who will be taking your live classes for pharma. Now he has already given you a schedule for how pharmacology classes will be there. I have given you a schedule for pathology yesterday. Today I will tell you what to do for microbiology. So when I talk about microbiology, and if I focus only on your professional exams, these are the kind of questions that you get. You get short notes, you get long questions, you get difference between. There are some variations university to university, and that is something like they say that explain why kind of questions come, reasoning kind of questions come. So those also we will cover depending on whichever. Once I know that okay, in a live class this is the college from which students have joined in, and I know that there is a certain pattern that is followed in that college, so I will teach you as per that as well. So depending on whichever colleges you join from, we will take into consideration every kind of pattern. And in many colleges there are MCQs also that are given, plus MCQs वैसे भी करना है ना, because your aim is to create a balance. You should be able to prepare for your university exam also, you should be able to prepare for your entrance exam also. So MCQ to anyway alongside करना ही करना है. So how are we going to plan this? I've told you there are going to be monthly classes for all three: path, micro, pharma. So you will have a proper timetable. We are not going to have everyday classes because we understand that in the morning you have your university. By 4:35 you guys tend to get free, and we will have classes 2.5 hours of class every evening. Not every, but almost, you can say, after 2 days. So we are giving you a good timetable. That means if today you have had a pathology class, you will have a 2-day break, then you will have a micro class, then you will have a 1-day break, then you will have a pharma class. So we are giving you that time in between because one, we know that you are reading everything for the first time, so you will need time to revise. And second, you will have so many commitments from your college also. You will have to make your files, you will have to study for, probably if you have tutorials or any other short exams in your college. So we have to create class schedule for you, that we give you that timetable that you can manage both things side by side, and whatever we will teach you will indirectly help you in your university also over there. So this is the plan that we are going to have. Someone, Dr. Singh, is asking me about FMG sessions. I think you are asking me about LRR. So that is going to happen on the app in the month of November. Okay, so that is scheduled for November. You will soon, in a few days, you will get the proper timetable also. Now coming back, micro में everything is similar to pathology that you can see over here. Timetable भी वैसा ही है, pattern is also the same. The problem is that there is a new CBME curriculum that is very troublesome for microbiology. Why? Because for every other things minor changes were there. Micro का बहुत major changes हुआ, and that change was that earlier the approach that was being asked, like when we used to study micro or till your previous batches, it was organism wise, bacteriology, virology, parasitology, mycology. अब क्या हो गया? Now it has changed. Now it has changed into organ system wise. Now we need to balance between both. So what I've done, first tell me in the chat box which is the textbook standard, like patho ke liye all of you told me yesterday that ma'am we are doing Robbins. What do you study in your university, whether you are in second prof or you are now in third prof? What did you study in microbiology, which is the standard textbook that you guys study? Like there are 2-3 textbooks which usually students go for. We have Dr. Anant Narayan's book, we have CP Baveja sir's book. So which book is being studied in your college? Because all books are equally good, but there is always a college bias based on what your seniors have told us. Okay, you've told me Dr. Apurv Shastri's sir's book is also good. Perfect. So these are the 3-4 books that you have told me about. I have just got you a screenshot from one book because मुझे सिर्फ topics enlist करने हैं. Do you have to sit and study all 3 textbooks? No. You have to pick up any one textbook which I leave to you, your wish. जो भी आपके college में your seniors have advised, or I would suggest that pick up the PDF that is so easily available nowadays, or sample pages. कोई एक chapter पढ़ लो, whichever book you feel is good for you, you can go in for that. So I have seen students follow Apurv Shastri sir's book, Anant Narayan sir's book. So that is totally up to you. I have just got you a screenshot to tell you कि ये topics है और हम कैसे पढ़ेंगे. So the first system thing that you have to start with is general. General में if you look overall ना, there is a lot of cramming up. But now, and I just want to clear this misconception. Now, what students have done is, many students only look at rapid revision videos and they get that feel कि अरे micro is all about rote learning, रट्टा लगाना है, we just have to mug up the facts and we have to vomit it out. That is the overall perception. But that is only when you see only rapid revision videos, because usme everything is very concentrated. So it looks that, oh, this is only mnemonics, only ratta and all of that. But when you actually sit down to see the main lectures of microbiology, you will realize that there is a lot to understand. There are concepts in microbiology. There is a lot of correlation of microbiology. So some things are pure ratta. Like for example, history mein, scientists mein, to I can't give you logic. We will have to sit and mug up. But when we talk about things like basics of bacteriology, now for example, if you just look at rapid revision video, I have taught you gram positive bacteria are purple, gram negative bacteria are reddish pink. But why? Why gram positive bacteria take purple stain? Why gram negative bacteria become reddish pinkish? Gram stain ka procedure रट लिया, but what is the physiology behind it? What is the underlying mechanism of a gram stain? ऐसा क्यों होता है? So all of that you will make a concept now. Either you see the main videos, but main videos for second year से भी better and detailed will be the live batch that we are starting with. Right now, let's move forward. We will go on to systemic bacteriology. Then of course सबका basic पढ़ लो, virology का basic पढ़ लो, fungus का basic पढ़ लो, parasite. तो overall basic सबका खत्म हो गया is my plan. After that we have microbial genetics, very tough, but we will make nice stories and we will learn nicely. After that we will go ahead with little bit of PSM coming into place, कि which country, which state, which region has more of which diseases. Then comes the most important topic. Guys, ये ना अच्छा नहीं लगता किसी student को, but second prof में you will not even identify the importance of this chapter. But when you will go to internship, just imagine, how should you clean a thermometer before using it for multiple patients? How should you clean your own stethoscope? You go to the ward, but when you come back, what should you clean your stethoscope with? If you're doing a laryngoscopy in the ENT department, what should you treat, or what should you clean the laryngoscope with? So many things you will realize. If as an intern you throw blood on the floor by mistake, you spill it, how do you clean the floor? All of those practical questions will come in sterilization, disinfection. Moving on, I will have to correlate it with pharmacology, which of course Ankit sir will be teaching you in a lot more detail. तो मेरा काम काफी आसान हो जाएगा. But yes, we will make sure this is integrated. This means if I have taught you the basics, Ankit sir will be teaching you the details of all the pharmacology drugs that we have. And finally, little bit of, as a healthcare professional, कंट्रोल कैसे करते हैं, हैंड हाइजीन क्या होता है, हैंड वॉशिंग स्टेप्स क्या होते हैं. दीज आर द काइंड ऑफ थिंग्स विच एज अ सेकेंड ईयर स्टूडेंट नो वन टीचेज यू. वाई? बिकॉज यू नॉट गॉन इन टू क्लिनिक्स एज ऑफ नाउ. तो आपको पता ही नहीं व्हाट आर द स्टेप्स ऑफ हैंड हाइजीन, व्हाट आर द स्टेप्स ऑफ हैंड वॉशिंग एंड सो मेनी अदर थिंग्स. तो वो सब हम जनरल में कवर करेंगे. ओके, मीनवाइल आई गेट अ क्वेश्चन. yes, exactly. So that Dr. Kashyap has asked me that, ma'am, in the NEET PG main videos we have organism wise, but what is being asked to us in our university exam exam, I'll come to your question first. What is being asked to us is system wise. Is this your question, Dr. Kashyap, that ऐसे दिया हुआ है हमारे university protocol में? They ask me all cardiovascular infections, then they ask me all AIDS in one place, then they ask me infections of respiratory tract. So let me take your with the help of an example कि हम कैसे पढ़ने वाले हैं, because second prof student को दोनों balance करना है ना. He or she has to give the university exam also. University exam is like this, and NEET PG FMG exam later on is going to be organism wise. तो कैसे इन दोनों का balance create करेंगे? Let me give you an example of infections of the respiratory system, for which I have actually got you a screenshot over here. So if you look very carefully over here, you will realize that this is just one screenshot of the respiratory tract infections that you have. I think there was a minor lag in between. Are we settled, or is there any other? Just someone had messaged or mentioned that I think we are connected, right? I would just need a quick thumbs up if all's well. Yes, okay. So yeah, coming back, when I talk about, this is your question, right? And this is what you're saying, तो recorded lectures देखना या नहीं, ध्यान से देखो. So for example, you say कि मैम मेरे को short note आया university exam में, that write a short note or a long question on all the respiratory tract infections. तो book them. It is neither gram positive nor gram negative. ये basic कुछ बनेगा अगर ऐसे randomly पढ़ोगे, that one side you read mycoplasma, other side you go and read Coxsackie. Would you even know Coxsackie is a virus or a bacteria? इसमें क्या property होता है? What is to be understood? So if you directly jump onto reading like this in second year, it is going to be a major flop. फिर वो full खिचड़ी, that full mess up in the exam and mess up in your brain also develops. So how will we be balancing, is it what I'm telling you? I will be teaching you both ways. Means I will be teaching you organism wise. Organism means that okay, I will start with bacteriology. I will teach you the bacteria, but now at the end of bacteriology we will make lists that okay, अगर cardiovascular पे short note आया, these are the 10 organisms I will write about. अगर respiratory पे आया, these are the 10 organisms I will write about. If it is a case of meningitis, then okay, Neisseria meningitis, Streptococcus pneumoniae virus पूछा तो I can talk about the viruses that cause it. This is how we are going to integrate. So if you ask me, ma'am, are you going to teach us organism wise or organ wise? I will say I will teach you both, because jab tak I don't teach you the basic, if I don't teach you what is Staphylococcus aureus, how can I teach you that what skin infection and what respiratory infection will it cause? If I don't teach you the basics of Streptococcus pyogenes, how will I be able to tell you कि ये sore throat भी करा सकता है, ये rheumatic heart disease भी करा सकता है, something very minor as pharyngitis also it can cause, something as major as RHD also it can cause. But what is the commonality between them? PSGN भी कराता है, cola color urine कराता है, but what is common? What do you know about Streptococcus pyogenes? Till you don't study every bacteria in detail, उसी में से you will make a short note and you will write it in your university exam. So I know this problem. The reason I have come up with the microbiology live batches, many students have told me that ma'am, NEET PG or FMGE videos are only organism wise, only bacteria virus अलग अलग, उसमें से we can never find out how to write our university exam papers. This is the batch where I will guide you by combining both. I will teach you organism wise also, I will be teaching you organ system wise also. So is that okay with everyone? Yes, all settled, all good. यहाँ तक ये वाला doubt clear हो गया, especially I think Dr. Kashyap had put it up to us. So I think this is settled. It is my responsibility that I have to make. I cannot go by the CBME curriculum alone कि सिर्फ उनके हिसाब से पढ़ा दो, but I don't make your concepts. That will be very wrong on my part. I will be doing both. If that takes 5-10 hours extra, not a problem, but I will be doing both. I will teach you the basics. I will make sure कि आपको अच्छे से bacteria, virus, parasite समझ आए. After that, I will make you write the short notes and the long questions that if it comes in your university exam, this is how you are supposed to sit and write it. Is that okay with everyone? Yeah. So Dr. Singh, this that you've asked me that you have a NEET PG account and whether you will be able to see the FMG LRR. Sorry, I don't want to comment on technical things. ये मुझे पूछना पड़ेगा. This I will have to confirm with the technical team once how it works. But after only that, I'll be able to comment back on this. So please write it in the comments so that technical team can get in touch with you regarding this. Okay, so thank you, Ankit sir, for joining in. It's always a confidence boost not only for the students but for me also when you you join in, and you always have that positive energy that you tend to transfer to everyone. So thank you so much for joining into the session. And yes, any other questions? Coming back, so this is the second part. We were talking about the systems. So हम system wise ही पढ़ेंगे, but with a little bit of a twist where I will teach you every organism, and then I will tell you how to write the questions also. Now coming to the third part. The third part is about immunology. Now the best advantage over here which I feel, immunology comes in 4 places in your entire medical curriculum. आप फर्स्ट ईयर में इम्यूनोलॉजी थोड़ा थोड़ा पढ़ के आए हो, दैट इज बायोकेम, सो दैट इज आई एम होपिंग याद है, नहीं है अभी नहीं सोचेंगे, बट पढ़ा है. देन द नेक्स्ट इम्यूनोलॉजी यू स्टडी इन पैथ, देन यू स्टडी इन माइक्रो, एंड सारा इम्यूनो व्हेन यू कंबाइन you are going to go into medicine. So that basically means that I am going to teach you path and microimmunology. I am the same person. I am going to teach you. So I exactly know कि hypersensitivity path में भी आता है, micro में भी आता है. I can integrate both, and I will not tell you to learn double. मतलब I will teach you one long question for hypersensitivity that you can write comfortably in pathology also, that you can write comfortably in microbiology also. So the load on your brain becomes lesser. आप easily एक ही क्वेश्चन को 2 जगह कॉपी पेस्ट कर सकते हो, एंड एवरीवन विल बी हैप्पी विद दैट आंसर. सेम गोज इन फॉर अदर थिंग्स. ऑटो इम्यून डिसऑर्डर्स पैथ माइक्रो दोनों में आता है. इम्यूनो डेफिशिएंसी डिसऑर्डर्स पैथ माइक्रो दोनों में आता है. नाउ व्हाट इज एक्स्ट्रा? दीज आर द थिंग्स विच इज ओनली इन माइक्रोबायोलॉजी. दीज आर द थिंग्स विच आर ओनली इन माइक्रोबायोलॉजी. एंटीजन, एंटीबॉडी रिएक्शंस, एलाइजा, प्रेसिपिटेशन, एग्लूटिनेशन, ये सिर्फ माइक्रो वाला पार्ट है. ये पैथो में नहीं पूछा जाता. दे यू डोंट गेट शॉर्ट नोट्स और एमसीक्यूज इन पैथो. So this I will teach you. Extra वाला part I will teach you in the micro lectures only. Patho में जो extra होगा, transplantation, that I will teach you in pathology. Whatever is going to be common to both, that I will teach you together. तो integrate इसी को कहते हैं ना, that you don't have to do कि मैम ये वाला hypersensitivity का आंसर माइक्रो के लिए था, ये वाला hypersensitivity का आंसर पैथो के लिए. It is a common hypersensitivity का आंसर that you will learn. Your mind gets the concept, and आप दोनों जगह उसको easily fit करके आ सकते हो. Now, these are the 3 things. तो क्या क्या बना? First, we have to study general, we have to study immuno, patho, micro combine, and my guarantee, patho, micro combine पढ़ लोगे तो when you will go on to medicine, तो वो automatically उसी का एक extended version है which will become so simple for you to study. So even I've seen students when they solve path, micro questions and then they go on to medicine questions, they can solve over 60% of medicine immunology only on the basis of the pathology and microbiology concepts. And the third, as I said, we will be studying both. We will be studying organ wise also, and we will be studying organism wise also, which means we will be studying in both manner. Combine करके concept भी बनाएंगे, अपना short note long question भी करेंगे. Now coming all the way back, I've told you the classes and these are the patterns. Now you can let me know what are your queries about microbiology. कोई doubt है which you want me to settle, because after this, once the theory is done, जैसे पैथो का प्लान था ना, पहले पूरा थ्योरी करा, after that time and again you will have guidance session. क्यों चाहिए guidance मैम, when we will anyway meet you live so many times? Guidance चाहिए about answer writing. Sometimes I have seen so many students, उनका knowledge is 100%, but somehow they don't get marks in the theory exams. Why? Theory exams are not just about knowing a lot. Theory exams are also about how you write. Answer sheet देखने में कैसा है, first appearance to the examiner कैसा है ना. Some people are very good with knowing things, but when you have to write it, they are not so good. So I will be giving you guidance about, time and again we will have sessions on how to write. या फिर उसके बाद जो third aspect आएगा, that is going to be practical classes. Means that you will now come down to the third thing, that is, मैम मेरे एग्जाम में वहाँ पे कल्चर प्लेट्स दी होंगी, ब्लड आगार, चॉकलेट आगार, हाउ विल आई आइडेंटिफाई. हैंगिंग ड्रॉप मोटिलिटी टेस्टिंग होता है कुछ यूनिवर्सिटी एग्जाम्स में, तो हाउ विल आई परफॉर्म दोज. So once we are done and we are close to your exams, we will have 1 to 2 sessions on practicals also. अब पूरा हमारा path, micro, everything is going to get settled in one way. I hope that is okay with everyone. Now we are settled, पूरा wholesome एक approach समझ में आ गया. And when are these classes starting for all 3 subjects? Path, micro, pharma, they are starting in the month of November. November and December, if you can see, if you open the app, if you have the subscription, you can see the entire timetable till June, July has been put up. But you will see that ma'am November and December में ना थोड़ा सा there are less classes, and then January से the proper pace is picking up. ऐसा क्यों है? Because right now we feel immediately if I start bombarding you with one class every day, how will you adapt, how will you revise, how will you get a basic hang of how things. So starting mein we have kept 4-5 classes every month, which is also, if you see, every class is approximately 2.5 to 3 hours. So you can see कि 15 to 20 hours तो आराम से है. But January onwards we have increased gradually. सब कुछ यहाँ पे step wise decide किया गया है, so that suddenly the student doesn't feel university भी जाना है. Then you know that starting में you start with a lot of motivation and you are very very motivated to put in all your effort. And then when too much of load comes on you, then you start skipping things. Either you will start missing university classes, or you will start missing these live sessions के बाद में recorded देख लेंगे, वो backlog बनता जाएगा and then it will be a mess. So we are actually making you adapt कि पहले get used to 1 class a week, get used to that, then 2 classes a week, then 3 classes a week. धीरे धीरे अपने आप you will get into the system and you will get a hang of it. Still, if you want to see the pattern, you can see the live schedule posted on the ProfEdge batch, which is there. Where to find it? In the video section, in the end you have a ProfEdge tab. You click on it, you will get Path Micropharma monthly schedule has been written over there. Okay, so right, Khushi, I've read your message for INI, although I don't think alag se, because now we are very close to the exam, so we again don't want to bombard you with unnecessary lectures. But the high yielding topics which were there are already given in LRR. जो हमारा अभी LRR खत्म हुआ, उसमें सारे high yielding sessions हो चुके हैं. All the high yielding topics have been covered. So if you just actually go through those, you are settled. After that, there is nothing more that you would be needing, right? Dr. Sonal, thank you for asking. I'm much better now. Okay, and yeah, any other question? Just going through all the things. I think I have YouTube sessions nahi honge, Dr. Sonal. They are going to be, of course, on the app only. Okay, and yeah, I can see Dr. Sahil joining in. Thank you so much. I think we as faculties, of course, try our best, but students always feel there is a certain gap for some reason. They always tend to ask their seniors. So if a senior can guide you on something because he or she is the one who's gone through that entire journey and that entire torture at the earliest, मतलब सबसे फर्स्ट हैंड एक्सपीरियंस एट दैट मोमेंट कोई आपको दे सकता है, तो वो आपका इमीडिएट सीनियर होता है, बिकॉज दैट पर्सन हैज गॉन थ्रू विद दैट एंटायर स्ट्रगल, वेरी फ्रेश इन हिज और हर मेमोरी दैट स्ट्रगल इज. सो थैंक यू डॉक्टर साहिल फॉर गाइडिंग द juniors, and I think that is a must. I would tell all, even if you are a very introverted person, I would request all the juniors and all the people to talk with your seniors and actually get a first hand feedback of what needs to be done. Talk to someone who has just passed second year. उनसे पूछो कि क्या क्या problem आई, what were the problems in second prof. They will all come back to you and say that second prof subject, अगर second prof में master नहीं करा, then this is going to haunt you till your internship, and you will keep having that guilt and that regret that why didn't I read path micropharma at that point. तब अच्छे से एक बार concept foundation बन गया होता, life would have been a lot easier. I know, I'm not saying you will read it and you will remember it till internship. भूलोगे. That is human tendency, that your memory will tend to, erase out a lot of things, and that is fine. But concept is something नहीं भूलोगे ना. Some ratta things you will forget. But concept once made will remain with you till your medicine, surgery, internship and beyond. So this is something that you will have to. I mean, I would have not emphasized on any other thing but these 3 subjects, because in retrospect, now today when I teach NEET, FMG students, retrospect में सबका एक होता है, like you can see a lot of students here also saying, ma'am, we wish second year में we would have put in that much of, थोड़ा सा effort ज़्यादा डाल देते, या we would have read path micropharma in that much of detail and with that much of sincerity, we would have been in a much better position. I don't want you to go through that guilt, जो मैं अब सुनती हूँ बाकी सबसे. I don't want कि कोई FOMO, कोई guilt, anything else should, at least you are in that situation, you should pass by very smoothly. Okay, so right, for those who have passed that phase, no FOMO, you live in the moment, you make the best out of what you have at present, and I'm sure you will also do well. ऐसा कुछ नहीं है. It is all about that whenever you join in, or whenever you start studying, or whenever you start trying to get things back on track, that is the best time, and you can make the best out of any moment, but doesn't mean that you leave it till that moment. Okay, so Dr. Shreya on the app has asked me, do we have a WhatsApp group? There is a WhatsApp channel for Second Prof, Dr. Shreya, which I will tell the team to post it once again on Instagram and Facebook and other platforms. WhatsApp channel alag se hai. There's no mutual discussion group as of now, but a WhatsApp channel where all the updates are put up, that is definitely there prof wise. So you can join in the Second Prof one or whichever prof you are in. Okay, so perfect. I think we are settled and good to go. So after this, I will be meeting all of you in November when we will start with cell injury. We are starting with pathology, and I have kept the topics and the timings in a very comfortable manner. Matlab, you might feel that ma'am recording में cell injury is only 4.5 hours, but in live classes you have kept it as 5.5 hours. ऐसा क्यों करा? Because I don't have to teach you only for NEET PG. I have to teach you short note, long question, how to write. I have to clear your concepts. I have to have a live batch, which means you will also have certain doubts. We will also interact. So obviously recording say everything is going to be 1.5 hour more, but not time waste wala more. It is going to be productive session where we will actually know कि अब हमने अगर cell injury पढ़ा ना, या फिर for example in micro, if we are reading, say we are reading the microscopes पढ़ा, तो now you give me a question of FMG, I can solve, NEET PG I can solve, INI-CET I can solve, and you tell me to write a short note on any one microscope, I can do that. You tell me to write the difference between light microscope, electron microscope, I can do that. You tell me to write a long question on all the microscopes, I can do that. उसके बाद you won't be asking anyone कि अच्छा कौन सा एग्जाम है जिसके लिए I have to go and sit. After that you'll be like, I have read microscopes, now bring it on. Now you give me any exam, any question, any pattern, I am ready for it. And you never know in the future, who knows if next comes up, then ma'am, will I be able to integrate this knowledge further? Yes. Even if I'm teaching you microscopes, it's not that I'm going to show you the photo of a microscope and say bas rat lo, these are the parts. I will tell you how to integrate it with medicine. I will tell you that okay, this is the microscope that you use later on if in hematology you are dealing with the case of hairy cell leukemia, ये वाला microscope use करना होता है. If later on you are dealing with the case of amyloidosis, तो कौन सा वाला microscope use करना होता है. I will be integrating it with diseases also. तो अगर आगे जाके next exam comes up, then these notes are not going to be limited to your university preparation. The same notes go forward for any exam pattern going ahead. Yes, so I guess we are done with the doubts as well. And yeah, thank you so much for joining in, everyone. As I said yesterday also, if you still have any other doubts, you can put it in the comments. Kal 3-4 doubts the, I have already replied to those. If you have any doubts regarding micro or otherwise for second prof, write it in the comments of this video and I will be getting back to you there also. Just one more question by Dr. Laksha on the app is, how to use clinical postings in second year? A very valid question. I would say that what students feel is, you've entered the clinics, if you know, and there are some colleges which are doing proper clinical postings. Some colleges I know are taking this very, very lightly and kuch zyada hota nahi hai. So my advice is, in second year, you are not going to the clinics to make a diagnosis. You are not going there to make, oh, this is a case of breast carcinoma in surgery, for example. You are going there to attain skills. If, for example, you have to examine a lump, Dr. Lakshay, be it abdominal lump or breast lump or any other on the forearm or anywhere, what are the pointers that you have to do? Apna clinical acumen. What do we mean by soft consistency? What do we mean by firm consistency? When do we say stony hard consistency? आपको वो develop करना है. That is what you have to do in your clinical postings. Right now is not going to be the time that, oh, I made the diagnosis of breast cancer and then I got a true cut biopsy done and then I got ER/PR HER2/neu done and what was the prognosis? That will happen gradually. But when you are in your second year, just attain skills, because abhi you are in that. And the best part, the younger you are, the more questions you can ask and no one will judge you. Ideally we all say na that you should ask questions whenever you have a doubt, but ek problem hota hai, as you will keep progressing to third year, final year, internship, you will stop asking doubts because you will feel shy that, oh, then this person will think that I should be knowing it. Second year mein to no one has any expectations from you. You can ask the dumbest of questions, you can ask the most nonsense nonsensical questions, बिना common sense वाला question पूछो, कोई आपको judge ही नहीं करेगा. Everyone looks at you like this new kid on the block, like this baby who's allowed to make any mistake, who's allowed to ask any question. Make use of that. Use that to your advantage. As many questions as you have, ask your seniors, your residents, your interns, your seniors, and get that clinical part out of it. Diagnosis नहीं बनाना second year में. Even if you're examining something as small as a sebaceous cyst, examine it from what all measurement क्या होता है, what is the site, what is the consistency, अच्छा how do we, then you go on to okay, this is a minor thing, so what do you do for the treatment. This is how you are going to step it up gradually. You are not going to put it into a direct diagnosis as a doctor, वो second year में करना ही नहीं. Okay, yes, Dr. Bharat, if for 2 months left, you can do any textbook that comes your way. 2 months बचे exam में, then I would not say that you go too much into concept clearing. When you are 1-2 months away from the exam, let's be honest, it is more about putting a lot of information in your brain and going and putting it out there and just passing the exam. जब last के 2 months होते हैं तब और कुछ नहीं सोचना. So that is a good textbook. You can easily settle for it. Okay, about FMG, I think I've already told the students. Someone on YouTube has asked me, FMG LRR November में होगा, वो बता दिया. It will be on the app. And lab diagnosis, someone is asking me how to, वो don't worry. So अभी I'm not going to tell you अलग-अलग topic. Join in, and for every organism there is a different lab diagnosis. For dengue virus you have NS1 antigen, but then you also have IgM antibody. Dengue I'm talking about because abhi season gaya tha. So then you also have viral culture, rarely done. But when you come down to streptococcal infection, you have ASO antibodies, you have different kind of culture media for streptococcal throat swab. तो सबका lab diagnosis अलग होगा. अब now if you know the concept, if you know ना कि streptolizin O एक antigen है, तो you will know that anti-streptolizin O antibody हम बनाएंगे. कॉन्सेप्ट पढ़ोगे तो उसका लैब डायग्नोसिस यू विल नॉट हैव टू मग अप, रट्टा नहीं लगाना पड़ेगा. बट इफ यू डोंट नो द एंटीजन नेम, व्हाट विल यू लर्न द एंटीबॉडी नेम. सो डोंट वरी, डोंट जंप टू बिग थिंग्स. First thing of starting a batch with any faculty and any platform is faith. कि इतना faith हमें रखना पड़ेगा that if a person in front of me is saying that ये I will make you learn this, then let's give that chance, let's keep that faith, and let's start with that positive attitude. Only on that note, I will wrap up and I will meet you guys in November, where we will start with the real batch and we will get going one by one, topic by topic. धीरे धीरे you will realize सब कुछ cover हो जाएगा. ठीक है? Right, so done with this, and I will be meeting you soon now on the app. Thank you so much. But yeah, if you have any doubts, you put it in the comments below, even anytime, not just today, tomorrow, but even till we start the batch. कुछ problem आया, कोई doubt है, strategy wise, joining wise, technical wise, put it in the comments below, and someone from the team, technical team, or I myself will be getting back to you. Thank you so much for joining in, guys.